What has been the impact of alcohol consumption on health in Ireland?
Well, I'd say this has had a devastating impact on the health of our citizens here in Ireland. Just to give you a few really quite awful statistics, in 2021, nearly 19,000 people were hospitalised as a result of alcohol-related conditions. The bulk of those, an awful lot of those, would have been to do with alcohol-related liver disease. And in fact, actually, the rate of ALD has increased by almost 80% over the last 20 years. So, that's just one statistic. Unfortunately, if we were to look at deaths, nearly over 1,500 people would die every year from alcohol related either illnesses or incidents such as things like assaults or falls. And then beyond that, beyond the health of the individual people who might be drinking, there's all the impact on those in society, their families, friends who are impacted in various ways. And a lot of that actually has direct impact on people's health as well. So sadly, there is a sad picture, but at the same time, there are things that can be done. So I still retain some hope and that we can address this problem.
What lessons can be learned from Ireland's implementation of alcohol harm reduction policies?
So Ireland passed quite comprehensive legislation back in 2018. It's called the Public Health Alcohol Act. And there was a whole series of measures around there, including things like minimum unit pricing, some controls on advertising in terms of content, in terms of where it can be placed, and also some restrictions on things like, special offers. So you couldn't buy, 2 bottles for the price of one or things like that. A very important element has been the labelling of alcohol products. That hasn't yet actually been implemented. It's due to come into effect from May 2026. But when it actually does come in, it'll require that all alcohol products would have a label on it giving health information labelling, including, for example, that alcohol causes cancer and causes liver disease, as well as warnings about not drinking in pregnancy. From an implementation point of view, I would say one of the most important things is for the government to be very proactive and kind of go out there and make sure that it is fully implemented. One issue that has actually derailed the legislation a little bit has been the proliferation of zero alcohol product marketing. So we have seen a huge amount of advertisements for these zero alcohol products, which have identical branding to their alcohol master brands. And you see this in the very areas where alcohol advertising has been restricted. So I suppose one lesson that I think we can learn from that is to really to nail down any possible kind of ways in which the industry can get around some of this legislation.
What is the aim of the European Alcohol Health Alliance?
The aim of it is part of a larger ambition that we have, that the public health community should stay united. When it comes to tackling alcohol-related harms, the harms caused by alcohol in society on people's health, social harms, legal harms, and so on, the industry, the alcohol industry is very united, not so much the public health community. So we're hoping to have all of these networks, all of these alliances, so that we can speak with one voice. When it comes to the one we're talking about today, the health professional one, it's going to be joining medical voices, medical organizations, clinical voices that have a lot of sway in communities, in the population. Doctors have, incredible credibility. When they speak, people listen. And so we're hoping that if not only one type of physicians, not just oncologists, but for example, but that all types of medical specialty come together and say, you know what, we need to take alcohol very seriously and stand united to find solutions. We think that this may lead to some success.
How does the WHO Alcohol Policy Playbook relate to the aims of the Alliance?
So recently, WHO released its alcohol policy playbook. The playbook's aim is really to help policymakers to identify when alcohol related issues are presented to them from a profit seeking perspective um, versus a public health perspective. And the playbook aims to ultimately ensure that when policymakers, when politicians decide to tackle alcohol, or even better, implement policies, that they will ignore arguments coming from the profit seeking perspective and rather base it on public health evidence. So I the link between the playbook and this alliance network where we're hoping to start is that we're hoping that they will be an additional voice to that will present this public health evidence and that will remind policymakers that, listen, if you're serious about health, if you're serious about public health, this is the evidence you need to look at. You need to disregard the evidence that is coming from a profit seeking industry when it comes to public health. I mean, profit-seeking industry is very good to talk about commerce and agriculture, and that they're very good at, and that's their field. But they are not right to tackle public health issues. That's our bread and butter, and it certainly is the bread and butter of medical organizations that we hope will carry this playbook and put it forward and support it and add their voice to it.